How to fade hyperpigmentation. Hyperpigmentation is a common skin concern, where certain areas of the skin become darker than the surrounding skin. This can occur due to various factors such as sun exposure. While it can be persistent, there are several strategies you can employ to help fade hyperpigmentation over time. Understanding hyperpigmentation. Before tackling hyperpigmentation, it's important to understand its causes and types. Sun exposure. UV rays can increase melanin production, leading to sunspots. Hormonal changes. Conditions such as melasma are often triggered by hormonal fluctuations. Post-inflammatory hyperpigmentation, PIH, occurs after skin injury or inflammation, such as acne. Skincare routine for fading hyperpigmentation. Implementing a consistent skincare routine can significantly help in reducing hyperpigmentation. 1. Daily sun protection. Sunscreen. Use a broad-spectrum SPF 30 or higher daily. Reapply every 2 hours when outdoors. Protective clothing. Wear hats and long sleeves when possible. Exfoliation. Chemical exfoliants. Use products with alpha-hydroxy acids, AHAs, or beta-hydroxy acids, BHAs, to remove dead skin cells and promote skin renewal. Physical exfoliants. Use gentle scrubs occasionally, but avoid over-exfoliation, which can worsen hyperpigmentation. 3. Topical treatments. Vitamin C, an antioxidant that can brighten skin and reduce dark spots. Niacinamide helps to even skin tone and improve the skin's barrier function. Hydroquinone, a skin lightening agent that can be effective for treating hyperpigmentation. Retinoids promote cell turnover and improve skin texture. Professional treatments. For more stubborn hyperpigmentation, consider professional treatments. 1. Chemical peels. Use chemical solutions to exfoliate and remove the top layer of skin, revealing newer, less pigmented skin. 2. Laser therapy targets specific areas of pigmentation with light energy to break down excess melanin. Microdermabrasion, a minimally invasive procedure that exfoliates the skin and can improve the appearance of hyperpigmentation over time. Lifestyle modifications. Healthy diet. Consuming foods rich in antioxidants and vitamins can support overall skin health. Hydration. Keep your skin hydrated to support its natural repair processes. Avoid picking at skin. This can lead to further inflammation and worsen hyperpigmentation. Patience and consistency. Fading hyperpigmentation is a gradual process, and results can take weeks to months, depending on the severity and treatment methods. Be consistent with your skincare routine and consult with a dermatologist to tailor treatments to your specific needs. By following these guidelines, you can effectively manage and reduce hyperpigmentation, achieving a more even and radiant complexion.